In Mixed Signals video series, today we talk about healthcare system and we'll try to compare the healthcare system in Germany versus the system in India. In India, basically, there is no standardized approach to healthcare system. So we'll see basically the healthcare system in Germany and we'll try to compare the benefits and disadvantages with respect to the system in India. So basically, there are two different types of healthcare systems in Germany. The first one is called the public healthcare system. So this is following the solidarity principle. So basically, the approach is like the following. So uh, everybody contribute to the same system. So this is so all independent of your rich or poor, you will contribute to the same system. The rich people contribute higher depending on their level of income, and the poor people contribute lower to the system. So this system kind of pulls in, and this creates a baseline for the healthcare system in Germany. And the benefits is distributed according to the need. So that means independent of what your contribution is, the priority is always for the people who are in need. So that means it's a fair approach where independent of what level is your earning, you get the service from the healthcare industry based on the severeness and the seriousness of the issue, not based on the contribution. So this is one of the biggest advantage of the system. And the second advantage is this system is basically based on appointments, and you have to plan your need as much as possible in advance. So that means, of course, when there is a critical issue or an urgent issue, it's handled differently. But otherwise, you have to plan your appointments and priorities well in advance, so that even when the system is running in capacity, you will get your chance according to your order of preference or order of priority. So sometimes there could be cases where if you have where you need some immediate support from the healthcare system on short notice, if it is not considered as one of the most critical topics, probably you will not get a quick appointment. So this is something which is makes it different from the traditional system. So basically, this healthcare system is one of the most common one. So normally, when you are new to the country or for your first time employed, you normally fall directly into the public healthcare system, and there's no prerequisite. So by default, you will be part of the public healthcare system in Germany. The next system is called the private health insurance system. This is based on the equivalence principle. So it is in from the concept point of view. So the more you pay, so the more premium is designed according to the risk and benefit you agreed upon. So it's based on a contract. It's not based on a flat contract like in case of public, but it's based on the contract that you agree with your private healthcare insurance supply partner. And then the higher premium you pay, the higher benefit you get. The lower premium you pay, the lower benefits you get. So basically, you can decide how much money you want to contribute to the system and what kind of benefits you want to gain from the system. Uh, so this is not fixed like in the case of a public healthcare system where it's a flat rate for everyone, and you pay a flat rate based on your income, what flat percentage based on your income. So for being in the private healthcare system, you need to meet some prerequisites. So of course, the details are it cannot be disclosed in this email from this session. So basically, we can offer you a free consulting session to discuss if which system fits you the best, especially depending on the kind of stay that you're having in Germany and what kind of needs you normally have. So there could be some financial benefits for being part of the private system, but we need to be careful about the contractual conditions. So with that as the baseline for our discussion, so basically, as I mentioned in the beginning, in India there is no standardized healthcare system, but that raises a lot of questions because as long as it's not standardized, there's a lot of room for deviations, and there is no it's depending on the individual or the institution policy that you can set the prices. So this is not the case in Germany. So in Germany, these are all standardized. So some of the questions that I have in my mind are how are healthcare information tracked? So especially when you are handling a particular situation where you have to get support from medical practitioners or clinics or hospitals, and you have to go more than one doctor at the same time. How is this information being tracked? So do you have to go through the whole diagnosis process again, or is there the history of this information tracked? In case of Germany, this isn't necessary because only then you'll be able to get the right support from the healthcare system. And the next question is who takes responsibility of the patient's life? So in case of Germany, it's very clear the doctor who prescribes them the medication or even makes a diagnosis has a clear responsibility of person's life and he's liable for any decisions that he makes. So therefore it has to be checked very carefully. But in case of India, sometimes I feel that some of these are not really, there's no liability on the practicing side. So there's especially doctor or the institutions like hospitals. So then the third question is somehow similar. So is there a logic for prescribing tests? So in Germany, it is absolutely necessary that the doctor should be answerable for the test that he prescribed to make sure that there's a logical reasoning behind why he prescribed this test and how is it connected to this diagnosis that he's doing. And also there is the second question, especially about India, is how hospitals charge cost for test and medication. So one reason why I put this question is in India, so if you compare the cost for the same service, so let's call it like an X-ray, and if you go to different hospitals in the same region, even when they're using the same machine or similar machines, they charge very different rates. And sometimes they claim that, oh, okay, we invested a lot of money in this equipment. Yes, but of course you are getting this return every time this machine is being used. And of course, this return of investment it takes time, and you cannot put that on the early users. So sometimes this is the explanation that I heard, which is very illogical to me because these kind of machines have very long lifetime. So is there a way to standardize this kind of charts and how to avoid this kind of institutions charge unfair prices for the patients? So this is something which I feel is something need to be done in India and to avoid fair service to all people. So yeah, so this is how the key differences between the health insurance system between India and Germany. Thanks for watching. Stay tuned for more videos.